Over the last 24 hours, we have identified 277 new cases of COVID-19 and have completed about 7,500 tests. Our positivity rate currently stands at about 3.9%. There are currently active alerts or outbreaks in 260 schools, or about 11% of schools in the province. Currently, these schools have a combined total of 862 cases since January 11th. There are 370 people in hospital, including 60 in the ICU. Our hospitalizations have plateaued over the last few days, which is a reminder that we must continue to protect the health system. Sadly, I must announce 7 new deaths that were reported to Alberta Health in the past 24 hours. My condolences go out to the family, friends, and caregivers of these individuals. To anyone grieving a loss, please reach out for any support you may need during this difficult time. It is important to remember that we are not alone, even in this pandemic. Unfortunately, recently, we have seen a small but significant increase in the number of people who aren't participating with the contact tracing process. Up to December, less than 1% of our confirmed cases didn't answer the phone or return calls from contact tracers. Since then, we've seen a concerning rise in those we can't get a hold of, 1.9% of all cases in January and 1.3% so far in February. In addition to this, there has also been an increase in those who were initially willing to speak to contact tracers, but then later unwilling to provide the necessary information needed for us to follow up with contacts. When this happens, public health follows up multiple times to try and obtain the details they need and sends written notice of information requirements under the Public Health Act for those who still do not provide the necessary information. But this leaves gaps that COVID is happy to fill. We have always been clear that we're watching the numbers, the leading indicators of our positivity rates, of our new case counts, and our R-value or our trends, to watch whether or not we have stable or continuing decreased growth in those 3 areas, or if we're starting to see an increase in growth. And that has been the focus. So since we started through these steps, we're looking both at that hospital metric, which is an absolute number, and we're also looking at those 3 leading indicators to determine, are they stable, are they declining, which are positive signs, or have they started to increase in a sustained way, in which case we would need to consider whether we need to pause our move forward, or even in a worst case scenario, move backwards. And again, it's those trends in those 3 indicators that are the important metrics to watch. We have been looking at all of the variant cases that we have and all of the locations where we have seen spread, which includes a small number of schools at this time. There are 3 schools where we have seen some limited transmission within the school. The numbers of additional cases have been relatively small, and at this time it doesn't appear that these variant exposures have led to significantly different outcomes in schools specifically than we've seen with our currently dominant strain of COVID-19. So we do continue to watch the literature. We're continuing to be in discussions with colleagues across the country to see if there are other factors that need to be taken into account. What we know is that within households, we've seen very significant risks of spread, which is why, for example, if individuals who live in the same household as someone who's diagnosed with a variant are all staying in that same household while that case is isolating, as you know, that those individuals are considered to be exposed every day. So if one of those individuals is a school child, they will have to stay home from school for the entire duration of time that the individual case is infectious, and another 14 days to prevent the risk of transmission. We are, of course, as I said, continuing to look at emerging evidence on the variants, and if there are additional pieces of work that need to be done, additional steps that need to be taken, we will make those recommendations, but those have not been finalized at this point.